This video will focus on the initial management of concussions and mild traumatic brain injuries. The information has been provided by the Ontario Neurotrauma Foundation's Best Practice Guidelines for Concussions and Mild Traumatic Brain Injuries. Following a diagnosis of a concussion or mild traumatic brain injury, a plan for management should be initiated. Patients should be educated about expected symptoms, strategies for management, the course of recovery, and how to gradually and progressively increase activity. A follow-up visit should also be recommended. Athletes should be educated about return to play protocols and the risks of returning to play without medical clearance. Patients who have had their first concussion or mild traumatic brain injury should be advised with early education, support, and reassurance that a typical recovery can be seen as early as a few days to 3 months post-injury. After the initial rest of 24 to 48 hours in the acute phase of the injury, patients should gradually and progressively increase their activity in a symptom-tolerated manner, meaning without symptom exacerbation. It should be noted that symptomatic patients should not drive for at least 24 hours after being discharged. It is recommended that treatment should be individualized based on the initial assessment, for example, the patient's symptoms and the physical examination findings. There is limited evidence to support pharmacological treatments for concussions. Active rehabilitation treatments are recommended, such as psychoeducational, psychological, and cognitive interventions. The integration of cognitive behavioral therapy to address thoughts and daily activities, along with cognitive rehabilitation to address cognitive difficulties, can be beneficial for those with psychological risk factors. Similarly, it can also be a treatment option for patients with multiple persisting symptoms. It is recommended that medications that may mask worsening symptoms or alter the patient's mental state should be avoided during the early stages of recovery. The primary care provider should routinely screen for depression and/or anxiety within the first few weeks of recovery, as these psychiatric difficulties may increase the risk of persistent symptoms and may require an early referral to specialty services or interdisciplinary treatment. Specialty referrals should also be considered for patients with symptoms that follow an abnormal pattern or cannot be associated with the injury, as well as for patients that have major comorbid conditions such as PTSD or depression. The following individuals should be referred for a comprehensive interdisciplinary evaluation by specialized concussion services or clinics: those with comorbidities or identified risk factors for persistent symptom development and who do not begin to improve within the first month, and patients with persistent symptoms greater than 4 weeks post-injury. Education on concussions and mild traumatic brain injuries should be provided at the initial assessment and ongoing as required. The education provided should be tailored based on the patient's symptoms and history and include information on the following: symptoms and expected outcomes, normalizing symptoms, reassurance about expected full recovery within a few days, weeks, or months, gradual return to activities as tolerated, and techniques to manage stress. Algorithm 2.1 Initial Management of Symptoms Following Mild Traumatic Brain Injuries is available for healthcare practitioners to assist with the initial management of concussions and mild traumatic brain injuries and can be found here. For further information regarding the diagnosis and assessment of concussions and mild traumatic brain injuries, you can refer to Sections 2 and 3 of the Ontario Neurotrauma Foundation's Guidelines for Concussions and Mild Traumatic Brain Injuries and their persistent symptoms. Special acknowledgements go out to the Kinesiology Department at the University of Waterloo, the Centre for Community, Clinical and Applied Research, and the Ontario Neurotrauma Foundation, which provided the funding for this video.